According to the CDC, infant mortality is the death of an infant before his or her first birthday. The infant mortality rate is the number of infant deaths for every 1,000 live births. According to UNICEF, maternal mortality refers to deaths due to complications from pregnancy or childbirth. The maternal mortality rate is the number of mothers who die per 100,000 live births. As we can see in both graphs, since the early 1900s, the infant mortality rate declined greater than 90%, and the maternal mortality rate declined almost 99%. When discussing the historic trends of infant mortality in the U.S., the CDC highlights that improving environmental and living conditions in urban areas, improvements in economic and education levels, declining fertility rates, the use of antimicrobial agents, the implementation of Medicaid and other federal programs were all key factors which were implemented into the U.S. healthcare system in the 1900s to combat infant mortality. When discussing the history of maternal mortality, the CDC displays data that shows maternal mortality to be at its worst in the U.S. between 1900 and 1930. During this time period, poor obstetric education and delivery practices were mainly responsible for the high numbers of maternal deaths, most of which were preventable. Obstetric care was provided by poorly trained or untrained medical practitioners. Inappropriate and excessive surgical and obstetric interventions, such as the induction of labor or use of forceps, were common and increased during the 1920s. Deliveries, including some surgical interventions, were performed without following the principle of asepsis. Through various reports and conventions, the issue of maternal mortality was finally brought to national attention in the 1930s, which saw hospital and state maternal mortality review committees established, as well as institutional practice guidelines. This crucial change in national attitude and policy allowed the healthcare system to effectively combat the issue of maternal mortality. There were safer deliveries in hospitals under aseptic conditions, and improved provisions of maternal care for the poor by states or voluntary organizations. During 1939 to 1948, maternal mortality decreased by 71%. Maternal health has plateaued over the past 40 years. However, most maternal deaths could have and can be prevented through the implementations that already exist.
Using data collected from several state review committees and their own data from 2006 to 2017, the CDC found that the infant mortality rate in the United States is 5.8 deaths per 1,000 live births, that on average 700 women die each year in the U.S. due to pregnancy or delivery-related complications, and 1 in 3 of the deaths of women that occur during or within a year of pregnancy, which is postpartum or pregnancy-related, and the cause of these pregnancy-related deaths vary with race and ethnicity. The NPR and ProPublica found that more American women are dying of pregnancy-related complications than that of any other developed country. Despite the growing technology and falling mortality rates of every other country, the U.S. rate continues to rise. This is a graph from ProPublica and NPR that shows the maternal mortality rate rising in the U.S. as it declines everywhere else. Black women have a dark past when it comes to obstetrics, a past that can help explain the present. James Marion Sims is credited as the father of modern gynecology. His research was conducted on enslaved black women without anesthesia. Sims' uses of enslaved black bodies as medical test subjects falls into a long history of medical apartheid that includes Tuskegee syphilis experiment. In both cases have long-lasting effects. For Sims' experience, these effects include promotion and validation of racist notions that black people don't feel as much pain, if any at all, in comparison to their white counterpart. This is proven in a study conducted in the University of Virginia, published in 2016, which explored the source of racial bias in pain assessment and treatment recommendations within a relevant population, i.e. medical students and residents. In a context where racial disparities are well documented, in their case pain management, their findings demonstrated that beliefs about biological differences between blacks and whites, beliefs dating back to slavery, are associated with the perception that black people feel less pain than white people do, and inadequate treatment recommendations for black patients' pain is a result.
Racial disparities have persisted for years when talking about maternal and infant mortality. Black women are 2 to 3 times more likely to die to a pregnancy-related cause than white women. According to the World Health Organization, these odds of surviving childbirth parallel those of women in countries such as Mexico and Uzbekistan, where significant proportions of the population live in poverty. When looking at where women live, black women still die at a rate 3 times that of white women. According to the CDC, this occurs in states that even have low pregnancy related mortality rates. From 2007 to 2016, the racial gaps in maternal mortality remain consistent, with black women dying at 2 to 3 times the rate of white women over the 11-year span. Racism plays a huge role in the disparities found amongst rates of maternal mortality, especially structural racism. Health disparities across maternal and infant health conditions, including maternal mental health, sudden infant death syndrome, sudden unexpected infant deaths, and cesarean section deliveries, show how structural racism and bias can impact health outcomes. Being subjected to racism for years is likely to cause weathering, which is the chronic effects of stress on the body, and in this context, the stress specifically stems from racism.
Wellness and medical issues such as preeclampsia and inadequate postpartum care are also factors that play a role in maternal and infant mortality rates. The CDC identifies that over 22,000 infants die in the U.S. in 2017 due to these top 5 causes: birth defects, preterm birth and low birth rates, maternal pregnancy complications, sudden infant death syndrome, and injuries such as suffocation. Pregnancy complications fall into factors such as anemia, hypertension, gestational diabetes, and overweight or obese lifestyles. Ellison Felix, world renowned track and field star, is another mom who went through a horrific childbirthing experience. Not only did she have issues in the hospital, but also with her financial security during her pregnancy with her sponsor Nike, where they were not trying to cover her pay during her pregnancy. Felix argues in her interview with Self magazine that black pregnant moms are fighting a plague of systemic unconscious bias that puts them at a disadvantage. She also says that it has no relation to who they are and where they give birth to the child because it will happen to a black woman regardless. Another mom who went through similar issues is Shalone Irving. Due to neglect and discrimination against black women, her nurses and caretakers just believed that her issues that she was having after the birth of her baby were just due to the fact that she just recently gave birth, and her worries were unnecessary. Unfortunately, 3 weeks after the birth of her newborn daughter, she passed. And if these matters were taken into consideration during her doctor's visits after the birth of her child, she would still be here today. More than half of maternal deaths occur postpartum. Beyonce and Serena Williams, two famous black women, also had complications during childbirth, and they have adequate health insurance. This is way more than money.
Before looking into the solutions for maternal and infant mortality, we must first distinguish the core problems that cause it. In general, the two core problems are limited resources and overpopulation that causes these limited resources. But there's a bigger problem that has to do with maternal and infant mortality, and that is the fact that race plays a big role in the mother's and infant's chances for life. The core problem that contributes to this is discrimination against people of color. Research shows that in general, African Americans have less access to prenatal care, and even when they get it, it tends to be less helpful. First, we will look at the solutions to maternal and infant mortality in general. The first solution is more resources. These resources include more educational resources for mothers, more easily accessible institutions for care, or more hospitals that are focused on pregnancy and early childhood. Another problem that causes infant and maternal mortality is overpopulation in specific areas. Although it is not very realistic for a quick solution, decomposition of population would help fix the problem by giving a more equal opportunity for anyone to get care when needed. Secondly, we will look at the solutions to solving race-related maternal and infant mortality. The first solution is stopping racism in institutions of care. Although there is no easy way to do this, policies that punish these kinds of actions are a step in the right direction. Next, we must address how to solve the problem of worse prenatal care for people of color. Although it is not true for all African Americans, a large population of minorities live in lower income areas. So increasing hospital funding in these areas would be a potential way to help solve the problem of higher maternal and infant mortality rates among black women. It is also important to know organizations that fight for these solutions. One organization is the National Birth Equity Collaborative. This organization researches mainly Black maternal and infant mortality and the causes for higher rates among them. They look at statistics including birth outcomes, trauma, and health in general after birth in Black women to get a better understanding of the causes and solutions to this problem. Using their research as a form of proof, the NBEC advocates for a systematic change that will create better treatment for women and make the treatment more accessible and more affordable.